The nation is bracing for the hellish hangover of holiday gatherings.
Yes, it was a long year. Yes, we want to celebrate. But when you increase social activity, you're going to increase the spread of the virus if people don't take precautions.
It's more than masks, hand washing, and social distancing.
I don't participate in indoor dining because of concerns about poor ventilation inside.
If you're heading for warmer weather where outdoor dining's still pleasant, experts say the flight itself is pretty safe.
The air on airplanes actually is not dangerous. Airports where there's congestion with people can be more dangerous.
Dr. Citronberg says avoid crowds, even when running errands. Long lines at the post office or the grocery store, go another time.
One-on-one interactions are about the safest that you can do. So if you go to get your hair cut, it's a one-on-one interaction with the person cutting your hair.
Or in an Uber or taxi. Even with masks on, more passengers add risk. Open windows and fresh air lowers the risk. As for school, we're told the evidence shows elementary kids are generally okay in class.
Normal classroom learning, you can separate the desks, you can maintain social distancing. In terms of contact activities, contact sports, like wrestling or basketball, I think you have to be very careful about that still because there's such high risk of contracting disease in that setting.
The biggest threat to our health and safety is getting fed up, letting down our guard.
People are tired, and I understand that. And at some point, we have to learn how to live with COVID until it's gone. So I think it's very reasonable to try to resume normal activities within reason and with caution.
Dr. Citronberg is telling everyone, get the vaccine as soon as you can, but know, though it may prevent you from getting sick, there's no evidence it keeps you from transmitting COVID to others. So these other precautions are still necessary, Shep.
You know, I was talking to my doctor about this just the other day, Contessa, and he's like, look, if you're going to have dinner, don't eat for a long time. And when you're not eating or drinking, put a mask on. It's weird, but it'll really save you because it's about the amount of the virus in the room.
Yeah, and Dr. Citronberg, I asked him about that. He says, look, you lessen your risk if you wear a mask before the food comes. When your server approaches, it's common sense, right? Distancing between tables matters. Eating only with those in your household matters. Outdoors, always safer than inside. But then you've got those tents and the bubbles that raise the risk because they have less ventilation. So, Shep, you know, this is all degrees of risk, and we have to evaluate it.
Shepard Smith here. Thanks for watching CNBC on YouTube.